In the previous video of Pathologies of Tongue, we read that the desquamation of the filiform papilla leads to benign migratory glossitis. Yet another pathology is associated with the filiform papilla that is called as the hairy tongue, also known as the linguavillosanigra. In this video, we will be talking about this pathology in detail. Watch the video till the end to understand it well. Hi, we at DentoRise welcome you all to a platform where we help you to conceptualize, visualize and memorize dentistry. Hairy tongue can also be called as lingua nigra, lingua villosa, black hairy tongue or lingua villosa nigra. To start with, let's talk about the etiopathogenesis of hairy tongue. Hairy tongue is caused because of the hypertrophy or defective desquamation of the filiform papilla. To recall, filiform papilla are the smallest and most numerous cone-shaped structures covering the entire anterior part of the tongue. When these filiform papilla undergo hypertrophy, that means increase in the size of the cells. When these filiform papilla increase in size, it leads to hairy tongue. If you are not clear with any of the papilla of the tongue or the terms such as hypertrophy, hyperplasia, etc., please do check out our videos on the papilla of the tongue and cellular adaptations. The link is given in the description box below. Now, what causes the filiform papilla to increase in size that leads to hairy tongue? There can be many reasons behind it. One of them can be lack of mechanical stimulation and debridement, which can be due to poor oral hygiene due to lack of toothbrushing, or eating a soft diet without roughage, because roughage helps in mechanical debridement of the tongue. Other reasons can be tobacco usage or drinking tea or coffee, or it can be also because of use of colored mouthwashes, breath mints, candies, etc. All these factors leads to hypertrophy of the filiform papilla. Filiform papilla has a normal size of 1 mm, but when they undergo hypertrophy, like in hairy tongue, the size can increase up to 15 mm. This leads to hairy tongue. Now let's look upon how this hairy tongue actually looks like. Looking at the clinical features of this pathology, there is no age predilection as such. It is more commonly found in males than that of the females. There is no racial predilection. The predisposing factors include patients infected with human immunodeficiency virus, that is the HIV, or those patients who are HIV negative and use intravenous drugs. Now let's learn how hairy tongue looks like. Hairy tongue can also be called as the black hairy tongue. This implies it has black appearance. In this pathology, the tongue has a thick coating in the middle with a greater accentuation towards black. The color may vary from black, brown. It can also be white, green or pink, can have variety of hues depending upon the etiology and secondary factors. The bacterial and fungal overgrowth plays a role in the color of the tongue. Please observe the figure very carefully. If we talk about the symptoms of hairy tongue, then it can be asymptomatic or it can be symptomatic as well. If symptomatic, it can lead to burning tongue called as glossopyrosis if it is associated with the overgrowth of Candida albicans. It is also associated with tickling sensation in the soft palate and the oropharynx during swallowing. It can also lead to gagging sensation in severe cases. It can lead to halitosis, that is foul smell from the mouth due to retention of oral debris between the elongated papilla. It can also lead to altered taste sensation, but it is a rare complication. Coming to the differential diagnosis of this pathology, if a superimposed oral candidiasis or other specific oral infection is suspected, then the culture of tongue's dorsal surface may be taken. Others include leukoplakia, oral lichen planus, and oral hairy leukoplakia. Distinguishing between oral hairy leukoplakia and hairy tongue becomes important if patients are found or suspected to be HIV positive. This can be accomplished by a simple mucosal punch biopsy and appropriate immunostaining of the specimen for the presence of Epstein-Barr virus, the causative agent of oral hairy leukoplakia. However, in most cases, the diagnosis is made retrospectively on the basis of clinical response to mechanical debridement. If we talk about the histopathology of this lesion, then we can see elongated filiform papilla with mild hyperkeratosis and occasional inflammatory cells. Debris accumulation among the papilla and candidial pseudohyphae are also common to be noticed. Coming to the last heading, that is the treatment. For any disease, the best treatment is to remove the etiology. Therefore, for hairy tongue, the etiology, that is the elongated filiform papilla, need to be removed. This can be done either mechanically or surgically. Mechanically, brushing of the tongue with a toothbrush or using a commercially available tongue scraper can be helpful. Surgical removal of papilla using electrodesiccation, carbon dioxide lasers, or even scissors is recommended, but this is the treatment of last resort. So this was all about hairy tongue. This was discussed under the headings of etiology, pathogenesis, clinical features, which included the age predilection, the gender predilection, the racial predilection, the predisposing factors, the clinical presentation, the symptoms, then the differential diagnosis, the histopathology, and the treatment. Hope the content was helpful for you. If you like our content, please do not forget to like, share and subscribe to our channel. Hit the bell icon so that you can get notified whenever we upload any new video. Suggestions are always welcome from your side. Stay tuned, stay safe. Thank you for watching.